that notion, because they say when you tell somebody you can go screening for breast cancer if you're a man, and they say, no, we do not have breasts. I've had such a conversation. I don't know if you've come across something like that. Have you?
Men do have breasts.
Yes.
And even we men know we have breasts. The difference is the amount of breast tissue.
Yeah.
The breast tissue in men is not as much as in women, but we have breast, we have nipple. The tissue is much less, and obviously for a man to spot alarm, a swelling, it's much easier because the breast tissue is very, very little. So it's very easy for a man to say, yeah, I haven't been feeling this little swelling under the skin, or I have noticing something unusual. We always tell people, two things. Look, just be familiar. How do they look like? Be very able to spot a change on the surface, and also feel. Is there a feeling? I haven't been feeling this swelling, then it needs to be checked. Importantly, because it may not necessarily be painful, but it's not been there. It needs to be checked. And most of that, maybe it could be something else. There are many breast diseases, but then cancer is one of the many, and you don't want it to be that. Some people may say maybe they have a lymph node under the armpit. That's swelling under the armpit. And it also needs to be checked. Is a lymph node, they can feel a little swelling that hasn't been there, because of the breast tissue being very minimal in men. The spread is much more faster, and I'm sure that Dr. will elaborate on that. It's much more faster, so they need to have that checkout. One of the biggest problems we have is the health-seeking behavior for men.
Right.
It's vastly different from women. Men just don't. We are very stoic. We believe, I'm a man, I can, I can ride through things. This macho thing of the men, it's pretty much what is affecting our health. So we need to make or normalize as men health checkups. Normalize checking with your doctor if something is unusual, even if it is on your breast. It's so the breast cancer and breast disease, it's not a women thing. It's an all of society problem. Right. So we need to seek advice.
And medical attention. Right. Yeah. And Mr. Makumi is talking about sometimes for men it's easier for the lymph node to spread, Chris. I think the breast area, the chest area. How about women?
So it is like normally breast, when it comes to breast, it consists of two parts. Like one is the fat tissue, the other one is glands. Glands has the lobules where the milk is made, and there are ducts which the milk which is made, which is it travels through the ducts and it is given to the nipple for the feeding purpose. Okay, though in men it is rudimentary. Rudimentary is non-functional. So in women it is well developed. Okay, and as Dr. Makumi, our colleague told, so now like in men the amount of fat tissue is less, as well as the gland. The gland is rudimentary; it is non-functional. Okay, so again in the women also, like normally the spread of the breast, as I told, the cancer normally arises from the ducts, either from the ducts or the lobules. Usually not from the fat. Okay, these cancer, it can spread locally inside the breast tissue. It can involve the surrounding structures like the skin, the chest wall, as it grows further, and it can also spread through the lymphatic. There is something called lymphatics, the lymph nodes, which normally it spread to the armpit. There are certain lymph nodes in between the breast. It's called internal memory nodes. There are also lymph nodes below the neck, the lower part of the neck. Okay, normally these are the areas the lymph nodes spread. The tumor can spread through the lymphatics. It can also spread through blood to different tissues. So it is in women also it is quite common. Depending on the extent, location, these lymph nodes are affected.
Yeah. And of course, before somebody comes to the hospital, one cannot wait for it to spread that much. That will be cause for alarm, right? But now the question would be, when it's still around the breast area, is it usually painful?
So it may not be painful. Most of the breast swellings are not painful at initial setting. But again, it depends if it is associated with, if there is any nerve involved, it can be painful. Okay. Or at the same time, if it is associated with any infection, it can become painful. It can occur together, like the infection part of the breast, the growth could be infected, so it can cause pain. But most of the cancers, they are painless to start with.
And Mr. Makumi, from the people that, of course, you interact with at Faraja Cancer Support Trust, how long did it take them, or maybe for them to get this treatment or to seek medical attention? Because maybe sometimes they feel there is a lump or there's a lymph node, they feel something quite hard on their breast area, but now they could ignore, they're in denial, the stages of grief. Then how do they tell you, how long did it take them for them to seek medical attention?
Yeah, I think good question, very good actually, because you can look at it from two different aspects. One, there's the element of the first time they felt something, and when they actually had an encounter with a health worker, with a hospital, with a health center. You know, there are people who will have had that for 3 months, even 6 months. You know, they felt a lump, but maybe they passed it on, or they consulted a neighbor, or they just didn't do anything about it because it wasn't painful. There are those who will very, very promptly feel a lump. The following morning they are seeing a doctor, or they are seeing a health worker. They are concerned. And for women, you know, women have a lot more encounters with the healthcare system than men. Maybe they are taking their babies for vaccination, so they may have an opportunity to point out the concerns that they have, maybe regarding their breast health, if they have felt something. But there is also those who will present to the healthcare system, and the healthcare system also lets them down. You know, maybe they have a lump, and if they are in the periphery somewhere, either their concerns are not taken with the weight they deserve, and you'll find that by the time they get a proper diagnosis, it may be a whole year of going around the hospitals. They've been to this health center, they've been to this sub-county hospital, but no one has actually sat to figure out what is going on. And some patients it will be a year, not because they didn't have an encounter with the care system, but because maybe the care hasn't been very well coordinated. So you'll find patients may come to Daktari and they say, well, I've had this problem for the last 1 year, for 6 months. Yesterday, I met a lady from one of the counties. She works for a family, and she has had a lump for 2 years. The first time she noticed the lump is 2 years ago.
So a lump is cancerous?
No.
A lump,
may not be.
Not necessarily?
No.
Okay.
9 out of 10 times it's not cancer.
Okay.
So, but then you need to figure what is it. Could be a benign, innocent lump, not always. But in her case, by the time she got a diagnosis, she already had lymph nodes. She had, swollen and all the signs that Dr. was mentioning. But when I asked, so when is the very first time? That was 2 years ago. Meaning by then, if she was to be treated promptly, that treatment should even have completed. But now she has complications associated with the fact that she's not even been treated. And why? Because then she didn't have the money. When she was asked to do some of the tests, if you are doing a biopsy to know whether it's cancer or not, you need to pay for that. She didn't have that kind of money. And so she still went away. And now when it became increasingly painful, there is a wound and all this. Now it's almost like I need to get the treatment right now. And so that's a whole 2-year journey. You're talking about different journeys of going to a hospital and not really getting the definitive diagnosis and definitive treatment. So what we say to tell women and the men if there is alarm does not necessarily mean it is cancer. If you are doing your own self-breast examination, we talk of it as self-breast awareness. Just be breast aware. Being breast aware does not mean you are looking for cancer. You are just aware of your own breast health. So if the problem you may have in the breast may not necessarily be cancer, but until you go and get it checked out, then you can't sit and assume it is not. Yeah. So the journeys and how long it takes, depending on whether you have money to pay for what is needed. By the time you are starting treatment, it may even be 8 months later. And you see that especially in the public sector, because you ask to do several tests. Like what that time you call staging workup. You need to do some X-rays, some scans, some blood tests to know where
diagnosis.
And we'll get right into it.
Yeah.
Let's just take